And joining us now is Becky Preve, who is the Executive Director for the Association on Aging in New York. Becky is the former director of the Franklin County Office for the Aging. You work with all 59 county area agencies on the aging. You work together on projects like this, the robotic pets that we just saw. Is that something that is being tried out in this part of New York?
Absolutely. Luckily, we started with the pet project even pre-pandemic. And so New York State Office for the Aging actually ran a pilot starting in 2018 where we distributed 60 pets to measure social isolation and loneliness. And at the time I was the Franklin County director, and of course I participated in the program with really, really amazing results. And we've seen that across the state, from anecdotal stories to the actual data, including published studies that show a significant reduction in social isolation and loneliness. I'll share that I recently was at a senior living community in Malone, and an individual that received a pet during COVID-19 allowed me to go into her apartment, and she told me that she had struggled with mental health issues and insomnia for decades. And from the day that she received the cat moving forward, she was off all of her sleeping medications because the purring of the cat was soothing her to sleep. So it's amazing to look at the data because we are a very data-driven state, but it's more amazing to listen to the anecdotal stories of people that just are thrilled with the pets.
And there are also computers that interact with the seniors, ElliQ, as we just heard about from Greg. And NYSOFA has put these out in homes of seniors statewide or just in select areas?
Statewide, actually. We were able to secure funding under New York State Office for the Aging and distributed a little over 800 of the units across the state. We're also running specific pilot programs with specific populations to see how we're able to really target individuals that are lonely or isolated. And I'm sure Greg shared the data with you that shows, well over 90% of participants have indicated that it's been a game changer in their life. I've been interviewed in the past where people have said, is technology really something that we should employ in older people's homes? And I would argue we would love to have, individual volunteers that could visit with older people that were lonely and isolated, but that's not the reality that we live in. And products like ElliQ and the animatronic pets are another tool for us to be able to provide individuals with really intensive conversations in their own home and communities. And again, anecdotal stories of individuals that have ElliQ in their home. ElliQ has become a friend. She's an amazing joke teller. She has wonderful data, and she also checks on the mental health and wellness of the participants on an ongoing basis. And I think what was really amazing for me is the number of interactions that individuals continue to have with ElliQ, not in the first week that they have the unit, but over the course of 6 months to 1 year, they're continuing that engagement.
Do we have any idea in Clinton, Essex, Franklin County how many ElliQ units there are?
Clinton and Essex both have deployed units. I'm not sure about Franklin. I think Clinton County, just based on the population density, has deployed more units, but Essex County is also actively recruiting individuals and have deployed some of the units.
And if seniors or families are interested, if they're watching this and this sounds like something they'd like to get, who do they reach out to?
Absolutely reach out to your local Office for the Aging and explain that you're interested in some of our technology programs. The other wonderful thing about reaching out to your local Office for the Aging is you may be eligible for programs and services that you don't know exist. So I always tell people, if you think you have a need or you think you could benefit from some type of community engagement or services through Office for the Aging, reach out. They're free services and you'll be assessed for all of them.
And we're putting those numbers and those web addresses up on our screen. Does it sound as if the state may look into expanding both of these programs?
Absolutely. So a lot of the work that we're doing in conjunction with our partners at New York State Office for the Aging are really data-driven. So we did a lot of pilot projects during the COVID-19 pandemic, and you can see through data what's effective and what isn't. And the two projects that you just mentioned, the animatronic pets and ElliQ, have far exceeded any expectation that we had when we went into the program. And so because we know they bear results in the future, there's something that we're going to continue to invest in.
And is that in the upcoming budget? Is that,
Correct.
Are you hoping to get more funding for them in
Absolutely.
that? And we're talking about budgets. That's a big thing for you right now this time of year, working on next year's budget for fiscal 25. You work closely with the State Office for the Aging, also with the county agencies.
Correct.
How is the Office for the Aging doing with state funding right now, and what are you requesting for fiscal 25?
So there's a couple things. First and foremost, and I know we've talked about this in the past, is the enormous economic value that the older population brings. So to kind of put things in perspective, the federal government puts in a little less than $80 million for aging services for the state of New York. The state of New York gives about $200 million per year, but the counties themselves are putting in about $335 million. To provide for older people to receive services, and it's woefully underfunded, and it's at the burden of the counties, who are very fiscally strapped at this point. The reason that we're asking for such a significant investment is not only due to the population density. You know, we know that New York is fourth in the nation for the 60-plus population. The fastest growing segment of the population in the state of New York are individuals over the age of 80, actually. But what's important about that is they pay $72 billion in state and local taxes every year. So when you look at the New York State Office for the Aging budget in comparison to what older people are paying in state and local taxes, it's woefully underfunded. And part of the reason that we're being, very data-driven in our budget ask for this year is because we know the value of the older population. We know through survey data that about 70% of older people are still actively engaged in their community. They're aging healthily. They're the biggest volunteer group in the state of New York. They're the biggest givers to philanthropy. And they are the biggest group of unpaid caregivers, worth about $39 billion a year if you had to pay them at the fair market rate. And so when you take that into account, you do have to look at those individuals that need that higher level of service, right? So home care services, home delivered meals, personal emergency response systems, and the fact that we have 18,000 people that are waiting for services today in the state of New York is really telling that we need a significant investment, not only to address the needs today, but also to look into the future at the older population, because it's very beneficial for the state of New York to keep older residents here. We don't want to lose them because they are such givers to the community.
So you're asking for $252 million this year to cover what sorts of programs?
To cover any and all programs and services. So we're currently going through a master plan on aging process, which is a joint project between Department of Health and New York State Office for the Aging. And part of what the advocacy community is trying to do is to really change the lens to talk about community-based care versus institutional care. And when you do the math on almost 5 million people over the age of New York, or over the age of 60 in the state of New York, we only have 165,000 nursing home beds. So we know the game is in the home and community. We serve them collectively with home delivered meals, with home care services, with case management for less than $10,000 per year per individual. That individual statutorily would qualify to go to assisted living or a skilled nursing facility to the tune of $140,000 to $160,000 a year on the Medicaid side. The reason I raise that is because in New York State, the Medicaid budget is coming up to about $100 billion per year, versus the New York State Office for the Aging budget coming in at $200 million. So if we know we can prevent those future Medicaid costs, we can prevent people from going into skilled nursing facilities, we need to invest in that service infrastructure to be able to support people in their homes and communities.
And you talk about some of the services that are provided. What's the greatest need right now? I know there are probably several, but what would be the greatest needs right now?
The greatest need, honestly, is home care. Home care has far and above been the biggest issue, not only for the Aging Services Network, but also the disability community. And that is due to a couple issues. Number one, reimbursement rates for licensed home care providers is woefully underfunded. And the second is that it's not a very attractive job for a lot of people to go into if they're barely going to make above minimum wage. Home care services are probably number one. I would say case management and home delivered meals are number two.
There has been a push in recent years to give caregivers more pay. Are you optimistic that this could be the year that the other steps will be taken to pay the caregivers more?
We are always hopeful. And I will say the last two legislative cycles, Fair Pay for Home Care has passed both the Senate and Assembly One House bills, and unfortunately have not made it into the overall budget. The advocacy community, from hospital systems to aging services providers to the disability network, have all stood up behind the fact that a home care worker should not be paid minimum wage. It is a job that is very skilled. These individuals that are providing home care services are medical professionals, they're social workers, they deal with very difficult family dynamics, and they're also intimately involved with the day-to-day activities of an older person or a person with disabilities. And to pay the same wage to a home care worker that you can make in retail or tourism, not that those jobs don't deserve fair pay as well, they're not equivalent jobs.
And you talk about waiting lists for seniors. You said 18,000. What services are primarily the biggest problem right now? And what are they waiting for?
They're waiting for any and all services. So we have wait lists for home delivered meals. We have wait lists for personal care services. So the home care services that I was talking about. We have a wait list for transportation. A lot of people that don't have Medicaid, that don't drive, they rely on transportation programs through Offices for the Aging.
Will your ask this year address a number of those shortages?
The ask for this legislative session includes the data and metrics on the wait list, so we know what a unit of service costs, so it's easy to do the math to say this is how many dollars we need to fill that hole. It also takes into account the fact that, and we all feel this at the grocery store or at the gas pump, the cost of inflation has significantly increased over the past 2 years. We have not seen an increase in the New York State Office for the Aging budget to offset those inflationary costs. And specific to our nutrition program, we actually have the largest nutrition program in the country, which we're very, very proud of. The cost of food and the cost of gas to deliver those meals has exceeded the budget for many years, and it's really hit hard the last 2 budget cycles because the not-for-profit service infrastructure that delivers those meals, they're still trying to do it with the same amount of dollars when the cost of food has, in some cases almost doubled.
You touched on this. Governor Hochul announced the creation of the state's master plan on aging a year ago, last November, that's being developed now. Public hearings being held, stakeholders being asked to weigh in and help create it. We had the hearing here in Plattsburgh this past summer. NYSOFA has been holding the hearings around the state. Also, NYSOFA and the Department of Health are currently sending out surveys, inviting people to weigh in on this. The surveys have gone out across the state. They have until the end of December to weigh in on this. This will be developed over the next year. The plan is to have this finalized by early 2025?
Correct.
And what does it cover? What does it look at?
So it's really a holistic look at aging. And so the master plan on aging really is looking at over a 10-year period to really talk about how we can make New York State a place where you can age healthily. If you do age and you need services, that you're able to access those services, and that we're really talking about prevention in the younger generation. It's really trying to make sure that all state agencies are thinking about the older population, and that we're also very focused on how we can make the state of New York somewhere where you can grow up and grow old successfully.
Becky Preve, thank you so much for coming in to be with us. We appreciate it.
Thank you.